You can't work a human being for 12 hours a day, 6 days in a row, or even 4 days in a row and expect them to remain safe and sane.
Mhm, mhm.
And
Agreed, agreed.
right. And so when you ignore the mental health care aspect of a caregiver, we compromise the safety of a patient. The current infrastructure, I believe, is failing to protect the very people who are meant to be the protectors.
Mm,
I don't think that we need more resilience training. I think that we need better staffing
mm.
ratios and just manageable schedules.
Hey, everybody, welcome back to another episode of Educators Game On. And today, as you can see, Ro is not in the pink chair today.
No, she's
We have a special co host today who I'll also be interviewing about education and nursing. And her name is T. And T, welcome as our first co host.
Oh, thank you. Very happy, privileged to be here.
Okay. Well, we're going to get right down to business, you guys. Okay. What first question I have for you, T? You've been in the nursing field for over 20 years. What made you decide to go from the bedside manner to educating part of nursing?
Well, that shift or spark didn't come from one dramatic moment. It came from time built over time at the bedside. I found myself really loving explaining and teaching the why behind the nursing skill or the diagnosis with a patient or even with my nursing peers. And I just kind of was at a point where I was like, oh, I really like this. I really like when someone has that moment of, oh, I didn't quite understand that, or thank you. I didn't think about it in that way. That really helped me understand what's going on. And I decided to pursue nursing after that in education, in the educational world.
Well, that's good because I've come across a few nurses that were not good and a few doctors that were good. But for most part, I should say my experience being in the medical field, not being in it, but having to be around people that work in it has been very good. So I thank you for being one of those educators and one of those nurses. Now, I'd like to ask you, how do you think that the industry in nursing has evolved over the last 20 years?
Almost definitely technology. So when I first started out as a nurse, when it came to charting, everything was written. So I remember going to get my patient medical records from the actual record department before I got my patients, and we would handwrite everything. So everything was task oriented, and it was then documented with a short little handwritten blurb. Now, everything is computerized, absolutely everything. And there's clear benefits to having this layered type of technology or complex digital systems that we have now. There's constant alerts and there's higher patient acuity. The pros and cons, I would say, would be there's faster access to information, there's improved coordination, and there's a decision support tools that can enhance safety. But then on the flip side, nurses are constantly processing, prioritizing, and managing interruptions. So the pressure has shifted from physical to now mental, and you find yourself doing a lot more electronic charting and less time at the bedside than you did when you were able to do it a little bit more quicker.
Well, that's funny because you said that because I do remember years back, everything was handwritten every time I went to the doctor's office or anything. And now I realize when I go to the doctor, everything's computerized. It's just like so simple. Well, it's not simple. You said it's more complex.
Well, for a good example is in the past, I could sit with my patients because I would chart after the fact. But now, when you go to the doctor's office, you see oftentimes your nurse is charting.
Mhm.
Sometimes her back may be to you because she has so much information to put in. So there's pros and cons. I really enjoy, though, that it's so much easier to you access to your information and you have access to your own personal information, whereas before you didn't have access to
No, that's
it.
true, true. I can go right online and just type in everything and I can see all my doctor's business. And I'm sure everybody else out there, you do the same thing. Just go into your little app and, figure out what happened at the doctor's office. Now, a question I have also is that you're currently in your MSN program. Congratulations on that. So happy for you. That's good. But the question is, how would you tell somebody who's listening right now if they wanted to get into the nursing field or in the teaching part and also on the clinical side?
Okay, that's a good question. So the essentials to nursing is getting your RN. And you can go two ways. You can get your associate degree, which is your ADN, or you can get your bachelor's, which is your BSN. And if you want to pursue an advanced degree, you would get your MSN. So I'm finishing my master's in nursing education, but there's also a master's in nursing administration if you want to be a leader. There's nursing informatics, which is the technology part of nursing. And then you could be a nurse practitioner, which is another master's level. And you could also get your doctorate in nurse practitioner. And if you don't want to do an advanced degree, say you just love being a nurse and you want to specialize, when I was at the bedside, I had my TNCC and my ENPC, which means I specialize in adult trauma nursing and pediatric trauma nursing. And there's so many things you could do. If you're an ICU nurse, you could specialize in critical care, and there's different genres that you like to specialize in. So nursing is very vast.
You're making it sound like that. So that means you can basically do anything you want as far as that going into nursing is concerned. Now, I've been reading about a controversy for the reclassification of nurses for student loans. Can you tell me a little bit more about that?
Yeah, so this is a hot topic, and it had me hot too. So there's a major misconception that nurses are no longer professionals because of recent policy changes, which is basically the 2026 One Big Beautiful Bill. And what that did was it created a financial parity gap by capping graduate loans for MSN or DNP students at $20,500 a year versus, say, medical doctors or lawyers, which are considered MDs or JDs, at $50,000 a year. So to be clear, whether the government gives us a $20,500 cap or $50,000 cap, our professional responsibility to our patients does not change. And to be even more, I know, to be even more specific, under the Labor Standards Act, LFSA, registered nurses are legally categorized as learned professionals. And if you want to look that is under 29 CFR 541.301. And basically it states, which required advanced knowledge in the field of science or learning. This status is independent of how a student loan is categorized. And to explain that just a little bit more, the reality of the 2026 One Big Beautiful Bill, what it did by capping graduate MSN and DNP loans and creating that financial parity gap, it created a systemic barrier. So that makes it much harder for hardworking nurses from a non-wealthy class to advance into leadership if they can't pay out of pocket. So it's a financial labor from the Department of Education that has real world consequences on who gets to become the next generations of nursing leaders. And basically, those are the ones who can afford it. If you can't afford it, then you can't be a nursing leader. Can you still get your RN? Yes, but can you become a nursing administrator, a nursing educator, a nurse practitioner, a doctorate of nursing, and nurse informatics? No, you can't if you can't afford it. And that creates a very big financial parity gap, and it's quite serious.
That is very sad to hear. I'm very sad to hear that. So, with you, how long have you been in this position again?
As a nurse educator
Yes.
for a couple of years or some time.
So you came out very good. You got it in time, huh? Before the big beautiful bill, which is not so beautiful after all for nurses.
No, and that starts this in June of this year. So if you're in a program now, you're fine. But if you're going to start a program after it starts in June, then you'll run across that issue of being capped at a certain financial gap.
But remember, everybody that's listening, that's thinking about becoming a nurse, we still need nurses. She's talking about just if you want to be an educator, this big beautiful bill has kind of made it going to be hard for people to try to get that.
Specifically for advanced nursing educators.
So let me ask you this: for nurses that feel stuck, what is your cheat code, or what kind of advice can you give them so they won't feel burned out? Because I know burnout is a big issue with law enforcement, in the medical field, in the law field. It's a lot of burnout that goes on in those particular fields.
So my insider advice for building a career that is both scientifically grounded as well as spiritually fulfilling. So
Oh yes, absolutely.
I would say stop viewing science and spirituality as two separate worlds. In nursing, I believe it's two sides of a coin. So to build a sustainable nursing career, you have to be scientifically grounded, which just means staying current with your peer-reviewed research. So you're providing the safest care possible, but also you have to be spiritually fulfilled to be able to survive the emotional weight of this type of work. I think of a scripture from First Enoch 5:8 that speaks about wisdom.
Great.
And basically it speaks about wisdom being given so that people may live. And I kind of use that in a practical terms as knowledge that, when applied, protects life.
Great. That's a good way to look at that. I appreciate that. That's nice. I'm sure a lot of the listeners out there will be appreciating that statement right there.
Okay, since I brought up wisdom, I want to just touch back on it and say that wisdom isn't just about knowing facts. It's about having the discernment to care for the soul while also treating the body. So, my
Mm,
blueprint is to use the evidence to protect your patients, but use your faith to protect your spirit.
mhm,
If you don't have a life of purpose outside of your hospital or your clinic, one that allows you to take care of yourself, take care of your loved ones, you will burn out. So, no matter how much science you know or how good
mm.
you are at your job, there's a balance, regardless, honestly, of your career path.
Well, let me say this. You talk about a haunting double standard. What exactly are you referring to?
So that double standard is one that we all recognize. So basically, if someone breaks a leg or has
Mhm.
surgery, people show up. They
True.
bring meals, they check in, they give you time to
True.
recover.
Mhm.
But when someone is struggling mentally, they can't sleep, they can't focus, they can't get out
Mhm.
of bed,
Mhm.
that same support often disappears. And that's a problem
Oh,
because
yes.
mental health isn't separate from your physical
Mm-mm.
health. Chronic stress, burnout, emotional strain, it all shows up in the body. It affects your sleep, your immunity, your cardiovascular health, and just your overall functioning. And I believe that all educators, play a critical role in changing that. So, by
Amen.
openly
Mhm.
addressing mental health, modeling supportive resources, our responses, and normalizing these conversations, not just in at work or in training,
Mhm.
but in practice
Mhm.
with your colleagues, with your
Mhm.
family, with your friends,
Mhm. And the community as a whole.
and the community as a
Mhm.
whole.
I think if the community, more people were involved, we wouldn't have this big problem that we have with mental health. Because I know a lot of veterans, they have suffered from mental health. A lot of them are homeless because they didn't get the care that they needed. I mean, the resources are there for the veterans, but a lot of people just don't, either the process is too slow or they just don't know where to reach out to.
And there's a lot of stigma
Mhm.
behind mental health.
Yes, that's true. Especially in the Black community.
Exactly.
Very bad.
Yeah. And that's where we as educators kind of come in to help remove that stigma
Mhm.
and create environments where people feel safe to
Great.
come and ask for help.
Good. That's good.
I also think that as educators, we need to push for a culture shift
Mhm.
where we respond to mental strain with the same level of care and concern that we respond to physicalities.
Absolutely. I totally agree with that. I've had some good nurses, I've had some not so good nurses, I've had some good doctors, and I've had some not so good doctors, but everybody does is not as compassionate about their job as other people are. You have to really be compassionate and want to do that job, to do it effectively. That's what I think. That's what I've tried to do in my when I was in law enforcement. So let me ask you this question. We hear about a nursing shortage constantly. Is it because of lack of people or is it because the infrastructure failure of the current mental health infrastructure within hospitals?
Well, from an educator's perspective, or from my perspective, I think it's not so much a shortage of people as it is a shortage of a sustainable environment. You can't work a human being for 12 hours a day, 6 days in a row, or even 4 days in a row and expect them to remain safe and sane.
Mhm, mhm.
And
Agreed, agreed.
right. And so when you ignore the mental health care aspect of a caregiver, we compromise the safety of a patient. The current infrastructure, I believe, is failing to protect the very people who are meant to be the protectors.
Mm,
I don't think that we need more resilience training. I think that we need better staffing,
mm.
ratios, and just manageable schedules.
Well, the big beautiful bill has really impacted a lot of areas within the medical field. So, how beautiful is that bill? You've talked about it a little bit. How beautiful is that bill? Not very. The look on your face is, what's beautiful about it? So, looking 5 years into the future, what's one major shift you believe that should, occur in the nursing industry to prevent burnout, total burnout, and also high retention rates?
That is, that's a good question. I think Well, if we make it in the next 5 years, you're talking about the big, beautiful bill.
If we made it for the end of the year,
Right.
which is no laughing matter, but yeah, we living in some serious times right now.
Agreed. I say looking into the next 5 years that we move past the word resilience, which is I feel is a buzzword, and start talking about systemic wellness. Well, again, and we take mental health and physical health as a whole.
Great.
Um,
Well said. Well said.
yeah.
Well said.
There's so I'm a veteran, a naval veteran, and in the Navy there is a program, or not a program, but well, I guess it's a program. It's something called stress first aid. And basically it's a peer support model that helps a team recognize and respond to stress early. And it has 7 core actions. So that's everyday support that anyone on a team can provide to someone who's going through high stress.
It's very important.
So checking for signs of stress, coordinating additional support when needed, covering to reduce, immediate pressures, and calming in the moment, connecting people to support, and restoring both competence and confidence. And I think that this type of system is very important in healthcare because it treats stress as expected rather than a weakness.
Mm.
And it,
Mhm.
right,
Great,
yeah,
yeah, because you expect stress in certain types of roles and jobs, and they should recognize they know that it's stressful already, but let's do something about it to make sure that we can ease up that stress that we know is going to occur.
you would be proactive instead of
Yes,
reactive.
yes, exactly. Proactive is reactive. So let me ask you this: looking back on your 20-year career, what do you want people to remember about you being in the nursing field and the nursing educational field? What do you want people to remember about that? About you?
Well, I want to be remembered as authentic. Definitely. Someone who showed up and advocated for her peers,
Absolutely.
someone who prioritized herself and her family.
Mhm.
And also, I want to be, remembered as someone who made the job a little easier for the next person. If I helped even just one person feel a little bit more prepared, a little bit more supported, or even just alone walking to a difficult situation, then that to me is a career well spent. And there's a lot of evidence behind that type of impact.
Mhm. Mhm.
Mentorship and legacy building are
Absolutely.
linked to professional identity and long term satisfaction in any type of job, I believe.
Mhm.
And this kind of reinforces that what we pass on to others matters just
Yes.
as much as what we do for ourselves.
True, true, true. That's well said, well said. Well, a couple months from now, we're going to have another panel with a few educators that have been on and some that are going to be coming on later on. And we would love to have you on that panel again. Just, we'll reach out to you and let you know all about that. But we want to thank you for being our first co-host and hopefully not the last time you co-host a show with me or with Ro. And we just want to say thank you to all our viewers. Thank you for coming to another episode. And guess what? We'll see you again on Educators Game On.